Coronavirus cases have been increasing in the province, with the latest figures standing at 22,705 confirmed cases. For more on this story, we are now joined via Skype by Limpopo's Health MEC, Dr. Phophi Ramathuba. MEC, good morning and welcome to the agenda. So the last time you spoke, you did tell us about this particular family gathering and this wedding. Can you give us any other indication in particular, like how many more people have been infected?
Yes, thank you, Adrian. Morning and morning to your viewers. What we can indicate is that after we were picked up that family, I think it was of 15, it appears that that's not the only family, because most of our district managers have been calling to say, MEC, even in my district, I've got a family of sorry. So what we picked up is during our spreadsheet of those who have tested positive, you'll find that you've got so many Ramathubas. And when we follow up the addresses who have tested almost positive at a similar time, their address are the same. That's how we are able to pick up now. It has become very common, the household spread of this virus, and caused by one individual who would either have been in a social gathering, being infected, not even being aware, come home, and at home we are relaxed. When you are with your parents and your children and your siblings, you don't wear mask, and it becomes easier to be infecting each other, which takes us backwards to say, as a province, we have raised it to say for all those that will be coming back from all the areas that have been declared as hotspots and have increased the numbers. When we were still recording 15 cases within 24 hours, today we've just recorded 316 cases, at least a bit dropped from the 400 and the 600 that we had the previous 2 days. But it's still quite very high compared to what we usually record as Limpopo. So our advice, our saying was to say, when you come back home, let's protect the elderly by, at least if we can, stay indoors or quarantine ourselves and don't come closer to the other family members for the first 5 to 7 days. We know after 7 days, if you have not shown any symptom, probably you are no longer even going to be infectious. And we know you would be safe to interact with the family members. But however, people arrive today at home, tomorrow it's a Saturday, there's a family gatherings, all the siblings are there. We are no longer even talking about where the clan, members of the clans are coming together. We're talking about immediate family members, your siblings together with your children and their children. And that's how it is. And it has become so common.
Mm-hmm. So then when we spoke about the restrictions as well that you would love as the province to be imposed, and looking into whether the president would be making an announcement anytime this week, how urgent is it for you from your department and what your department is currently experiencing, considering these gatherings are still continuing?
As a province, we are indeed in a dire need for that, those interventions that will come, those restrictions. We are, I must indicate to say, we are seeing a lot of trauma as a result of alcohol. If you remember, on Saturday, just after our interview, I had to rush to Elim Hospital, wherein the staff was devastated, being expected to resuscitate a drunken driver who was involved in an accident with, I think, 4 more passengers in a taxi. They came home for holidays from other provinces. They were visiting family members. Instead, they went on a drinking spree, they went on a partying the whole night. In the morning, when they decided to drive wherever they wanted to go, they met this hard-working nurse on a way to save lives, and they crashed into a car. She died on the spot. Now, colleagues in Elim Hospital are expected to resuscitate these drunken drivers. They are expected to save lives of those that have caused a serious damage to us as the nation, not just the Department of Health or the 2 children of a professional nurse, Susan Muraudzi, but to all of us, because her task was just to preserve and save lives. And we must also, at the same time, we have to create beds because they've suffered fractures. Some of them, they've got fractures, but at least they survived and were given an opportunity to resuscitate them. We were not given an opportunity to resuscitate someone who's innocent. They are now currently occupying our beds. They must now be taken to theater to be operated. And we are in the middle of the pandemic. They have reduced the workforce that is supposed to deal with the pandemic. So honestly speaking, for us as a province, when we look at the accidents that has happened, last night I was up until 2 a.m. trying with the response team to try to find a way on how can we deal with this current bed shortage. Because being a weekend, our beds are full because of trauma patients. If you remember during the first wave, some of the beds, we reserved them for COVID-19. We created wards for COVID-19. When we started to slow down, we then opened those wards for even trauma or any other burden of disease. Now we are back to another resurgence. Now we are saying when we are in this resurgence, we require those beds. Now, what are they expecting from us? You know, there was a time where one would even think of saying, if you're involved in an accident, being drunk, you have caused the accident, you shouldn't be a priority in our facility. Because there are innocent people who have been infected by COVID while sitting at home, have never left their houses, but they are now positive and they are sick and they require our assistance. And you have occupied that particular space, not only the bed, Adrienne. The problem is they are also occupying our energy, the energy of our health professionals. Because dealing with patients who are drunk is the worst thing you can ever wish for if you are a healthcare worker. You should come to our casualty and see those drunken stab wounds. We call them like that in our language. You should see how they insult our nurses, how they insult our doctors, because they are not sober. So this is what is compounding the current problem that we are facing. So for us, we feel that the issue of alcohol, it's time that serious actions has to be taken for that, because we have tried to work with the police to say, this is a person who came after midnight, he's drunk, he has been stabbed in a tavern, we have sutured him, can you arrest? We are also asked to say it is not a criminal offense to be found after the curfew. So that's another a challenge which is complicating things for us. So yes, in a nutshell, we're really in dire need of that particular those restrictions to be pronounced so that we can focus on dealing with COVID. And we know our team has got the capacity to can deal with this COVID, but having to deal with all these other issues which are man-made, it is a problem for us. Because if you get drunk and you drive, you have caused that problem. You are a murderer to me, in my language. In terms of the law, it might not be, but for me, if you were not drunk, you would not have caused an accident, you would not have killed anyone.
MEC, can you just quickly remind us what are some of those restrictions that you were calling for?
We have been indicating to say the issue of saying curfew 22 hours is not assisting. We are approaching New Year's Eve. We should be able to be stricter than that. We should be cutting down on social gatherings. We have to do that because this is some of the areas that are, because what like I've been emphasizing is that it's not only worsening the issue of spreading the virus itself, it is also overstretching us. Social gatherings should be done away with. We should re-look into our funerals. We've already encouraged the people of Limpopo that we don't need the president to tell us that if you are not the next of kin, don't attend that funeral, because it might be the last funeral for you to attend. So let the next of kin be part of those who will bury their loved ones. If we are not those close family members, we don't need to be, because when people hear that it's 100, what I've noted when I do some monitoring, you'll find people pitch up a tent of 20 people, but because they were told 100, then there will be 100 people in that particular tent, which still becomes much a disaster. So for us is to say, let's cut on that. Let's cut on those gatherings. Let's cut on those social activities. It's festive period. Let's spend this festive period at home. But also, we are also worried. For instance, in Musina, we have last night, the report that 28 employees have tested positive in one of our quick spa. And when we try to look back, you will find that there was no compliance. Even we are pleading to business people. Level 5 lockdown will be a disaster to you. But you are leaving us with no option but to call for it, because if you are a shop owner, there's one shop owner in Thohoyandou who refused to wear mask, and when he doesn't wear mask, even the people who are coming in to buy, they are not wearing masks. There's no social distance. People put something, they mix water and whatever it is at the door and say this is a sanitizer. You could feel, even when you try to smell, that there is nothing here. It's just a pure water plus whether it's Jig or Dettol or whatever they've mixed there. So we are just spreading the virus. And when restrictions come, we are the first to cry. If we were doing our part, because like I said, we don't need the president to tell us don't do this, do that. We just need to remember that our health is our responsibility. That's all. If we do that, all of us, and we know that we care about our grannies enough to protect them from getting infected.
Okay, on the 28 staff members from that quick spa who have now been infected with COVID-19, what can you tell us in terms of the investigation and also the tracking and tracing?
We have started the process of tracing. Remember, each and every one of the 28 has got family members. So you must know. And those family members probably over Christmas were together, braaiing or having a family gathering. We must start to look, and there is not even attendance registers in all these social gatherings that we see happening. It's going to be a very tough. That is why we are also solely dependent on individual to say, when you are positive, try to reach out to those that you have been with yourself. WhatsApp all those to say, I've tested positive, can they please go to the nearest facility and be tested? Because it has become difficult. People are no longer complying. These 28 staff, you'll find that on Saturdays, they've been attending funerals and Sundays all over. And in those funerals, I've noted that people are no longer having those attendance register. So the other issue that we have also noted, I was discussing with the CEO of Musina Hospital, wherein they have done even local campaign, visited even the very same, and talked to them when they were not happy about the compliance that I'm talking about. But still, we are shocked. People are shocked when they've tested positive. The response team in Musina says to me they are not shocked, because they've been in this spa several times to try to talk about can we really comply? Can we not relax and think this virus is meant for other people? The virus is not meant for any other specific individual. The virus is for all of us. We are just fortunate that our 28 employees, we don't have anyone with serious illness which requires a serious admission. But we are not fortunate, Adrian, with other families. What we picked up when we were analyzing our statistics, when you have a group of family members, and one family member, I think an elderly lady, has already been buried when we were doing an analysis of this. And that is what we have been, my biggest fear was that when I get infected, won't I infect my mother who is elderly? If she gets infected, will she survive the virus? That is my biggest fear. And if all of us can be able to have that fear, then we will not insult politicians and scientists when they are advising us against this virus. Because people think we are still it's a talk show. The fact of the matter is that we are working with these patients. We have seen them testing positive. While they do have comorbidities, we admit, but these days we are seeing even young, healthy people getting to be admitted even in our ICU. So this, we have to stop it, and it's up to us, all of us, to can do our part to be able to win this.
Okay, just with people who may have been at that quick spa, what would your advice be to them? Because we have changed our strategy, and our strategy initially was that if you had come in contact with somebody who's COVID-19 positive, go and get tested. But now we've changed and we said that first show some symptoms and only then get tested. What's your advice then to people who may have been at that quick spa?
I think what we are saying, like I've said earlier on, our main focus is on these 28 and their close contact. Those are the ones that we know we are really advising to say you rather self-quarantine and observe your symptoms and then go to the nearest facility to be tested. But those who are their family members, we have started the process of testing those that we know. So the same will apply to those who have visited the spa. Start to observe yourself, because you have not visited the spa only. You have also visiting another area. That is why we are saying, wherever you go, whatever type of surface you touch, whoever you shake your head with or you are hugging, just know that that person might be infected and your source of infection. So if you are in a spa and you enter without sanitizing your hands, remember 1,000 of customers went through that door and did not sanitize, and the chances of you've got more than 100 or 200 who are positive in that, and they have been touching all those groceries that you are going to touch, and you came in and you touched them, you also might have contacted the virus there. So we're saying everybody, hence our approach to support is to say we can't be specific to this particular spa. Because remember, this particular quick spa, we were fortunate because 3 of employees became symptomatic and we started to test everyone. That's why this is happening. There are other areas, other shops where people are not even aware that they are positive, or others have tested, they are not even coming up to inform their supervisors that they are positive, being afraid of stigmatization or all other issues that are associated with COVID. So what we are saying is that if you yourself as an individual, just observe yourself daily. Any signs of COVID-19, you know all those symptoms that we've spoken about, please visit your nearest facility. We are going to test you. Because yes, indeed, because of the volumes of the work that we're doing, we are, of course, most of the time prioritizing those who are symptomatic.
Mm-hmm. Okay, and then just finally, MEC, if you can give us an update on the Beitbridge border post, and then also the last time we spoke on Saturday, a question that I asked was whether your province has picked up this new variant 541V2 from the positive cases so far.
Adrian, in terms of the border post, I can with confidence indicate that we are working, led by Home Affairs, as I've indicated on Saturday. The Minister of Home Affairs is leading us. Our teams are currently meeting to plan the return of people, because that is where our most concern will be in terms of port health services. At the moment, if you look at the update, most of the vehicles were able to be cleared and the traffic is currently flowing. As the Provincial Department of Health, working with Port Health, we have deployed a number of community healthcare workers, a number of professional nurses, so that they can support the environmental health practitioners at the border post to be able to check and also those who might be requiring emergency healthcare services. And of course, for us, we want to reassure people that come January, when everyone is returning to the country, everything will be in order, because the directive from the national would have been clear whether we are demanding the results 72 hours. If that is the case, we've got different laboratories that will be on site to be testing, because this time around people will be coming to our country. But what is currently happening is that people who are leaving the country, because they know where they are going, they are expected to have results. They use us at the border to test, and that's what clogged even the queue. And that was, I feel, was being unfair and abusing our system, because the directive was not to say, come without results, we will test you. it was saying bring your results. For any other reason, if the results have expired for more than 72 hours, we will provide testing. That's why we had that mobile laboratory testing services. So for now, we are releasing all the vehicles. When they come back, that's when we are going to be working very hard to make sure that those who are clear of the virus are able to enter our country. And I think in that way, I don't remember what was your last question.
Okay, I'll ask you the last question now, but just a quick follow-up to this one. So if somebody comes back into the country via the border post and tests positive at that mobile laboratory, what happens?
That's what we are indicating that the team is currently working on. Because remember, initially we used to have facilities that we are quarantining people. Currently, we still need to go down and discuss, because as a province, we have indicated to National that we are resource constrained. We will not be having any facility now looking at the numbers who can be quarantined people who are coming to the country from outside. People must do it at their own cost. There we will be able to provide them with lodges where they will be able to pay and be able to do that. But that is not a call for me to make. It is a call that will be made by my principals. And we are waiting for that directive. But the position of a province is that we will not be able to quarantine anyone. Our few areas, resources that we have, which we are quarantine people, we are looking at our own people who can't quarantine themselves at their own household, because we know we are a rural and a poor province. When people test positive and the other family members are negative, we provide them with those quarantine facilities. And at the moment, we are overstretched because of the current situation that we find ourselves in.
So you don't know that if somebody comes back and says that I can't afford to accommodate myself or find accommodation at a B&B or whatever lodge, what happens to that person?
Hence, I'm saying if we can allow and give space to our superiors to finalize that agreement. For now,
okay,
we will expect you to self-quarantine. That's what is happening in most of the country in the world. Allow us to use the minimal resources that we have to deal with those people who are sick and make sure that they get treatment. But people who are traveling, if you are traveling and you go and do the test, 72-hour test, they tell you are positive. If you come to the border with positive results, you are simply saying we must call police to arrest you, because you cannot be traveling with positive results. That's the first thing. Because my main concern in this country is that where is the responsibility of individuals? Everything must be blamed on authorities. We are not coming in to say we will be able to play our part as citizens, because unless we come together to fight this, we're not going to win.
Okay, then the final question was around the 541V2 variant. Has that been detected in your province?
We haven't got the official report on that, but from me where I'm sitting, when I'm analyzing the data that I have of those who have tested positive and those that have admitted in the hospital, and also look at how the virus has been described by scientists and the variant has been described by the scientists, I also am confident and believe that even in our province we are dealing with the same. Firstly, we are not a federal system. We are in South Africa. We are part of the country. I've already indicated from the 11th of December, we've seen many people traveling from as far as Eastern and Western Cape to come to their home province. Because if you go and look around the provinces, you'll find that we've got a lot of people who originate from Limpopo who are working in those provinces. They are back because it's holidays. So there is that is the first reason that is how they could have we could have find ourselves with the very same variant that is being discussed. Secondly, I must also indicate that when I look at the number of people infected, I've seen a lot of young people. Actually, between age 15 and 35, there are so many. They lived. When you look at, unlike compared to during the first wave, where mostly was from around 45 and going upward. Now we are seeing as young as 15 who were previously saved and preserved from being commonly infected by this virus. These days we are seeing it, and when we look at the description, we were told that it's indeed targets even the young people. Thirdly, we have seen the rapid spread of this particular virus. Like I would say, today we would have registered 396 new cases within 24 hours. The following day, we jumped to 676 new cases. So that tells you that the spread of this virus is not like when we're dealing with the first wave, where you are going to have 10 new cases today. Tomorrow you will have 11. The other day it will be 13. The other day, so there was no that exponential shooting spike that we are seeing currently happening. And the last one is that when I look at hospital admissions, during the first wave, we were dealing mainly with the elderly people and only those with comorbidities, and they are the ones who were succumbing to this virus. And you would see what is currently happening. Actually, the young people, we are seeing some of them having to succumb to this virus. And we are also seeing young people getting serious symptoms, even those that are not admitted. But the bottom line is, during the first wave, people will test positive even without symptoms. Actually, majority of our cases, when you look at the first wave, they were positive but asymptomatic. And when you look what is currently happening, most of the people who test, even if you test positive today, in the next 2 days, you will be having serious symptoms requiring admission. So that when I look at all those presenting, how this virus is presenting in our province, I am convinced that while I will not get any official report to say, we have detected this variant in your province, I think we do have.
Okay, thank you so much for that. That is the MEC for Health in Limpopo.